Shine. She woke at 3 in the morning. Her legs would not hold her. She grabbed the edge of the bed, but her body felt like it belonged to someone else. She had been perfectly healthy 12 hours ago. Within 6 months, her older sister forgot how to speak. The woman was 42 years old. She worked as a secondary school teacher in a small Italian town. Her medical history was unremarkable. No chronic conditions, no prior neurological complaints. She described the onset as sudden and disorienting. One night, she simply could not sleep. Then the sleeplessness became permanent. According to case records published in medical literature, she reported to her local physician within the first week. He prescribed a mild sedative. It did nothing, but the symptoms did not stop. Within weeks, her balance deteriorated. She could not walk a straight line. Her pupils became unusually small. She sweated through her clothing at rest. Her blood pressure fluctuated wildly throughout the day. The doctor referred her to a neurologist at a regional hospital. An MRI of her brain appeared normal. Blood panels showed no infection, no inflammation, no metabolic disorder. An EEG revealed subtle abnormalities in her sleep architecture, but nothing that pointed to a clear diagnosis. She returned home without answers. She told her husband she felt like her brain was shutting down, one room at a time. Sleep became impossible. Not difficult, impossible. Her body forgot how to do it. Then her sister, 3 years older, developed a tremor in her right hand. Within 2 months, the sister could no longer form complete sentences. Words came out fragmented or not at all. The family watched 2 women deteriorate in parallel. Both had been healthy. Both had lived ordinary lives, and now both were losing control of their own bodies. If every scan looked normal, if every blood test came back clean, maybe the doctors were right. Maybe it was stress. Maybe it was psychological. The family considered this. They wanted it to be true, because the alternative was something no one wanted to say out loud. But here's where the medical records become unusual. When physicians reviewed the family history more closely, they found something no standard workup would have revealed. Their father had died in his 50s of a rapidly progressive dementia. A maternal uncle had died the same way. A cousin had developed similar symptoms a decade earlier. The pattern was not coincidence, it was inheritance. The condition was fatal familial insomnia, a prion disease so rare that fewer than 40 families worldwide have been documented with the genetic mutation that causes it. Prion diseases are neurodegenerative disorders unlike anything else in medicine. They are not caused by bacteria, viruses, or fungi. They are caused by a single misfolded protein. The prion protein exists naturally in the brain. In its normal form, it is harmless, but when it misfolds, it forces neighboring proteins to misfold as well. This cascade destroys brain tissue from the inside. In fatal familial insomnia, the damage concentrates in the thalamus. The thalamus is the brain region that acts as a gateway for sleep signals. When it is destroyed, the brain loses its ability to enter sleep entirely. The mutation responsible sits on the PRNP gene, chromosome 20. It follows an autosomal dominant pattern of inheritance. This means each child of a carrier has a 50% chance of inheriting the mutation. According to published research, symptoms typically emerge between the ages of 35 and 60. Once symptoms begin, the disease progresses relentlessly. Clinicians have documented an average survival of 12 to 18 months after onset. There is currently no cure. No treatment has been shown to slow the progression. Sedatives do not induce real sleep in these patients. Studies using positron emission tomography show progressive hypometabolism in the thalamus as the disease advances. Researchers have explored experimental approaches, including anti-prion compounds, but none have reached clinical effectiveness. What researchers cannot yet explain is why the misfolded protein targets the thalamus so specifically in this variant, while other prion diseases destroy different brain regions entirely. What this family illness cluster revealed is something deeply unsettling about inherited prion disease. Each generation watched the previous one die, knowing the mutation might live inside them too. Genetic testing can confirm whether someone carries the PRNP mutation, but a positive result offers no treatment path, only certainty of what is coming. Some family members have chosen not to be tested. The medical literature describes this as one of the most difficult decisions in genetic counseling. The woman who woke at 3 in the morning unable to stand did not survive. Her sister did not survive. Their cases, documented in Italian neurology journals, contributed to the broader understanding of how prion diseases cluster within families. Researchers now use these family studies to investigate whether early intervention before symptoms begin might one day alter the course of the disease. That work is still in its earliest stages. Her legs would not hold her that night. She had been healthy just hours before, and within a year, the disease had taken everything. Her sister followed the same path, one by one, just as the generations before them had. If someone in your family carried a gene that guaranteed a disease with no cure, and you could find out whether you had it, would you want to know? This video is based on real, publicly documented medical case reports and is intended for educational and storytelling purposes. It is not medical advice. If you or someone you know is experiencing similar symptoms, please consult a licensed physician. Medical Mysteries, true cases, every week.